Mohs surgery is one of the most common surgeries that are done for skin cancers. Mohs stands for micrographically oriented histographic surgery, which is a mouthful. But essentially what dermatologists who specialize in this type of surgery will do is remove skin cancers, and as they are removing them, they will take the sections and tissue that they removed and in real time look at it under the microscope and look at all the margins and make sure that everything is clear of cancer. Where we get involved as plastic surgeons is in the reconstruction after Mohs surgery. And there's several ways that we close these wounds or defects. We may be moving tissue from the surrounding area by what's called local tissue rearrangement or adjacent tissue transfer. Another very common way is using skin grafts, and in the case of the face, we'll use full thickness skin grafts from either behind the ear, in front of the ear, if people have enough laxity, sometimes even above the shoulder blade or the inner arm, all areas that usually will produce a good skin match to the area to be reconstructed, and that will also close nicely and have a nice donor site. So on the day of surgery, usually we will have coordinated this with the Mohs surgeon, so a lot of times they get the removal of the cancer itself by Mohs surgery on the same day, and then they will come to us for the reconstruction. I'll see them, we'll go over the surgical plan again. A lot of these procedures are done under local anesthesia, so then we'll go back to the operating room, we'll numb up the area, do our procedure, put a dressing on and get them on their way. So after Mohs surgery, there's a period of healing, obviously. They'll have local dressings or a bolster dressing there if they have a skin graft, or sutures that need to be removed at about the 1 week mark. I'll usually see all my patients at the 1 week post-operative mark. We'll remove any sutures at that time. We'll look at a skin graft or the tissue that we've moved around. And usually within the next 2 to 3 weeks, they're healing great and they're back to normal activity overall within 2 to 3 weeks. Some patients will have barely noticeable scars. Others, depending on what procedure they had, will need some more healing time for those scars to fade.